I see more people joining us. Welcome. Yes, I see some questions in the chat. This webinar is being recorded, and we will email you the PowerPoint presentations, as well as a link to the recording and a certificate after the webinar. So welcome, everyone. Welcome to today's webinar on provider well-being during a public health crisis. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers School of Health Professions, Department of Psychiatric Rehabilitation and Counseling Professions. My name is Katy Rivera, and I'm the project coordinator of this center, and I'll be facilitating this webinar today. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Before we begin the webinar, I wanted to quickly review some housekeeping items. We have a listserv that we encourage you to join so you can keep up to date with all of our activities and offerings. We'll include the link to sign up in the chat box. We also wanted to let you know that today's webinar is the second in the series of webinars that we'll be hosting over the next several months on the practices that support recovery from serious mental illness. Next slide, please. We wanted to encourage you to complete the survey that you'll receive via the email following today's webinar. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys, so we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website. And lastly, this webinar will be interactive. On your screen, you will have a taskbar with buttons that say Q&A and chat. Please use the Q&A feature to ask our presenter questions throughout the presentation. I will collect your question, and as we go, and ask them of the presenter during the Q&A time toward the end of the presentation. During the webinar, our presenter may pose questions to you. And so please use the chat feature to answer those questions. Now let's begin our webinar. Provider well-being during a public health crisis. Joni Dolce is an assistant professor in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers School of Health Professions. Joni has several years of experience working in the behavioral healthcare settings, namely support employment. Joni teaches courses in the department's undergraduate program as well, providing training and technical assistance to behavioral healthcare providers. Her research interests include staff training and employment services. She presents nationally on the topic of employment services and is listed as a Society for Human Resource Management recommended speaker on the topic of creating workplaces that support mental health. Welcome, Joni.
Thank you, Kati. I'm excited to be here today. Before we get started, I thought we would spend a few minutes just looking at this rating scale. It's the SUDS rating scale, or the Subjective Units of Distress Scale. It's used to measure the intensity of distress or nervousness in people. It's a self-rating scale. It's a subjective tool that you can use, or you could use it with individuals that you're providing services. And I wanted you to take a minute just to rate your current level of distress. As you can see, it goes from 10, unbearably upset, to the point that you cannot function, all the way down to 0, peace and complete calm. Spend a minute looking over these ratings and see where you fall. And I'm encouraging you to do this and to periodically assess your level of distress. over the next few weeks so that you can begin to see what progress you're making in terms of your own wellness and your own self-care. Hopefully you'll be able to implement some of the tools and resources that we are going to be discussing today, or continue to use some of your own wellness tools. And you don't have to give us this information. This is not for us to see. This is really your own rating, and you can write it down somewhere or just remember what it is, and you'll have these presentation materials after the webinar to periodically assess your progress. So now that we've kind of looked at your level of distress, why don't we get into the content of today's webinar? We're really focusing on three main objectives. We're hoping to recognize the impact of this current mental health crisis on your provider well-being, really examining the difference between this current crisis compared to other crises that you may have gone through in the past. We're also going to help you to identify the signs of distress and burnout, as well as applying wellness strategies to address these signs of burnout and distress. A public health crisis causes distress for all involved, including providers of behavioral health services. And attending to our personal well-being during this time is just as important as supporting individuals receiving services. So this webinar highlights specific tools, strategies, and resources that will hope to promote your well-being. So before we get into more of the content, let's focus a little bit on your breathing. And I wanted to start with this brief exercise to demonstrate the importance of just taking a minute or two to relax. What happens when we relax? We have better judgment, we might be less impulsive, we might be less anxious. And oftentimes when we are utilizing some of these breathing techniques or other mindfulness techniques that we'll get into when we talk about strategies, we're spending less time worrying. So it's very difficult to be mindful and focus on your breathing and worry at the same time. So I'm gonna play this little clip. It's about a minute and a few seconds. And I want you to breathe in while the shapes are growing and breathe out while the shapes are shrinking. And I want you to just take a normal breath. Taking a too extended of a breath could stimulate your nervous system, so we really want you to just breathe normally. So we'll talk a little bit more about breathing when we talk about the strategies. So we've come to this familiar scene, this scene of a seemingly very relaxed person, possibly working remotely from the comforts of their own home. I don't know about you, but this isn't what my home work life looks like at the moment. I have 2 kids and it's pretty hectic, and certainly doesn't look as cozy as this person with their cute little dog and comforting beverage and cookie. But that is really one of the distinctions of this current crisis. Many of you have been thrown into working at home and doing remote work. So in addition to managing the associated stressors of the COVID-19 emergency and the fears and the trauma that that's creating in us, we're also managing this new mode of work. And for many people, that means we might be homeschooling our children. We might be providing for other loved ones in our home. We're also out there in the world trying to survive even just grocery shopping in a very new way. So this remote learning or remote working environment is very different from some of the past crises, where if you think about 9/11 and even some of the hurricanes that we've gone through, we were not sequestered at home. We were told to get out and be part of society and help one another. And you saw images of people hugging and high-fiving and really closely connected physically. And that's currently not what is happening during this particular crisis. We're being told to not have that level of physical connection with people. So there's a quick poll that Kati will bring up, and it's just asking if you're working from home, just to get an idea, and we can see if others, how many people are working from home, how many people are not, are people working a combination of home and community/office. So just click the button and we will be able to get a gauge of how many people are working from home currently. And once you're finished, we'll be able to bring up the responses. Just take a minute to please vote. Oh, it looks like maybe the poll's not showing up.
Hi, Joni, it's Kathy. Yes, the poll is visible. So people are voting right now. Of 148 current attendees, 130 of you have voted. 111 or 85% say yes, they are working from home. 7%, or I'm sorry, 7 participants or 5% said no. And then we have a good 10% that is saying it's a combination of home and community office.
Great, thank you so much, Kati. So yes, it's very clear, thank you, I can see the poll now. It's very clear that many of you are working remotely from home, and that presents these unique challenges attributed to that social distancing. You're all familiar in the behavioral health care services, really providing much of your work face-to-face, really providing most of your work in the community with individuals, whether it's directly working in community-based mental health centers or going into people's homes if you're in case management or other community-based services or supported employment or supported education. You're meeting people out in the business community, and that's very different, and that's currently not what's happening. So these face-to-face meetings have now had to be quickly adjusted to more remote and other means. And we'll talk a little bit about continuing to engage individuals receiving services as we get further on into the presentation. So another quick poll, just to get an idea of what's the impact of this current crisis on your well-being. And there are some responses. I can't tell because I'm in it. I'm hanging in there, but by a thread, I can tell I'm getting overwhelmed or I'm coping well. And we did the same webinar about 2 weeks ago. So I'd like to see if the answers are any different from that group. So be curious to see if in this 2-week period, if any changes in these responses might have occurred. Okay, so about 4% of people, about 5 respondees, can't really tell, they're in it. People are hanging by a thread, about 20%. 40% or so are coping well, and the other group, 36%, is beginning to recognize that they are beginning to feel somewhat overwhelmed. About the same as last time. I think we had a higher percentage of people in that beginning to feel overwhelmed, but roughly the same. Well, actually, coping well was about 27% last time. So it seems like maybe within this last 2-week period, people are recognizing some of their own wellness tools and own wellness strategies and are putting those to use, which is great that you're beginning to use some of those tools and self-care to continue to take care of your wellness. As we just saw, it may be very clear to you that you're experiencing distress, or it might be more subtle because you're in the thick of the crisis yourself. Here are some specific signs that you might see that you're getting close to burnout or compassion fatigue. And the signs of distress that can lead to burnout and compassion fatigue are noted on here. Compassion fatigue, just as a quick description, or vicarious secondary trauma, is much more serious than general burnout. It's really that caregiver, provider experiencing trauma after witnessing another person's physical, emotional, or spiritual type of pain. And you should remind yourselves that in addition to the trauma that you're all experiencing living in this crisis or amid this pandemic, you're also going through this and hearing individuals that you're working with talk about distressing and traumatic stories that they're experiencing. So you're vicariously hearing additional, which is compounding that trauma for you. So it's even more important to notice these signs of distress so that you can begin to take precautions against burnout and compassion fatigue. You might see that you feel helpless or hopeless. You may feel like you have nothing that you're able to do, or you're unable to help individuals in a similar way that you were able to support individuals receiving services in the past. Maybe recovery plans have been altered to include more wellness activities, and some of the recovery goals might have been shifted, and that could be an unusual feeling for you if you're used to working very closely on helping individuals achieve recovery-oriented goals. You might be more hypervigilant. You might have that increased alertness and feel a more hypervigilance during this time. You might also be afraid and having that fear that you will contract this virus yourself or pass it along to your loved ones, and just the overall fear that this current pandemic is eliciting in many of us. You may feel guilty that you're not doing enough. It's a very unique position you're currently in. As we mentioned earlier, you're used to going out into the community and going out and meeting with individuals in their homes or in the community-based settings that you may have worked at, or at the job site or education program. So that feeling of guilt, like you're not doing enough, may be present as well. You may also have this inability to empathize or a difficulty empathizing because you're also experiencing a lot of fear and sadness and potentially feeling overwhelmed. So it may be difficult for you to empathize with others at this time. And we know at the core of behavioral health care and providers of mental health services, our ability to empathize is critical to that helping profession. So some of the outward signs, again, you might be arguing more with others. You might have different emotional outbursts that are uncharacteristic, crying more, angry more. You may have this sense of fatigue and feel that you're less effective delivering services. You may also have this negative outlook and feel that this is not going to end, and how will this play out? Sleep disturbances are another factor that many of us during this time may be experiencing. We may be sleeping too much, we may be sleeping too little, we may have interrupted sleep. So those sleep disturbances are also indicators that you may be under distress. Isolating, even social, we're told to physically isolate from others, but there have been a lot of connecting opportunities within some of my friend groups and work groups for people to get together socially to combat some of that isolation. But if you are beginning to feel like you're not even interested in connecting by Zoom or GroupMe or other apps or other methods with your friends and family, you may be nearing distress, or you may be getting close to that feeling of burnout. And finally, lack of patience. You may be juggling so many tasks at home, whether that's homeschooling or caring for people in your household, or even the act of grocery shopping has become so stressful that lack of patience. So these are, again, just signs to look out for, that you may be nearing your level of distress. And again, using that SUD scale is another way to measure your progress towards diminishing some of the distress. Some other wellness self-assessments are noted on here. The professional quality of life measure is a very quick, easy to use subjective tool that you would self-assess. So you can use this website, go right into the tool. Another tool is the self-care assessment from therapistaid.com. Again, gives you some categories of self-care and helps you identify if you're sort of slipping in those categories. Just sort of, when we're in the thick of it, when we're in this crisis, it's often difficult for us to notice how stress is impacting us, or if our self-care is slipping, resulting in maybe increased anxiety and, again, that potential for burnout. So these two assessments are useful tools in addition to the SUDS. And also consider, when you're feeling well and in a good space, it might be a good time to begin identifying those emotions or feelings that you tend to experience when you are getting close to burnout, when you are feeling distressed. Sometimes once we can notice those triggers, as well as those early signs that things are beginning to spiral down, it helps us then, when that begins to happen, we have tools available. You might have a trusted friend or a coworker or family member that can also point out signs of distress that they may be seeing in you. Again, it would have to be a trusted person that you would feel okay giving you that information. And then Mary Ellen Copeland's RAP and SAMHSA has a similar tool, and I have that on the next page, that may also provide some strategies to help you plan in this crisis, or when we're out of this crisis somewhat, some planning tools that you may want to identify as helpful to look at your triggers outside of this crisis or outside of the pandemic. These are helpful tools to look at what triggers some of the distress or some of the burnout for you, as well as what you can include in your wellness toolkit, is what Mary Ellen Copeland refers to, some of the wellness strategies or other tools to use when you are planning for your wellness and your self-care. So again, these are some websites: Mary Ellen Copeland's RAP, Wellness Recovery Action Plan website. And Mary Ellen Copeland also currently has information specific to this COVID-19 pandemic and maintaining wellness during the COVID-19 pandemic, which may be useful as well. SAMHSA also has a similar tool that you can access using this website. So now that we have sort of looked at the signs of distress and you're able to recognize that it might be important to start taking care of your wellness, let's start digging into some of the strategies. And the ABCs of wellness have been kind of discussed in the literature. Gillis and Perlman and Karingi kind of reference these three areas, ABC, awareness, balance, and connection, to sort of categorize some of the wellness areas that we want to pay attention to. So we're going to go through each of these and talk about some specific tools and strategies that fall under these awareness, balance, and connection categories. So when we think about awareness, we're really looking at that mindfulness and helping us to maintain that in the moment presence. We may want to journal or keep a gratitude journal, would be even a way to practice gratitude each day, identify, or each week, or whatever makes sense for you. Identify something that you're grateful for. Identify something small, something large, whatever that might be, but practicing gratitude and journaling might be something to do as well during this time. Journaling helps to improve our well-being in just a few minutes. So writing out what it is that you're grateful for, writing out what it is you're fearful of each day can be a really simple way to manage stress, sometimes getting it out there, identifying in paper just that cathartic expression of your gratitude or your fears may help you just in a few minutes a day center and ground yourself so that you're able to take on some of these new and unique tasks that we're all currently experiencing because of the social distancing and fears around the pandemic. This small blog provides some really good online tools for journaling, different apps that are pretty inexpensive or free in most cases. When you get the PowerPoint at home, you can just click on that and you can see some of those options. Some other apps that are useful for meditation or mindfulness is the Insight Timer. It helps with sleep, anxiety, stress, meditations. It has some different insightful talks that would be inspiring or help you just maybe learn a little bit of information about certain areas. For example, they have a talk on the Insight Timer on coronavirus, 10 insights to find the silver lining and hidden benefits. So these very brief talks or these very brief musical pieces are really designed to kind of help you sit in the moment and practice that mindfulness. The Smiling Mind is again another daily meditation and mindfulness exercise app. It really helps identify areas to balance your life even outside of this crisis. Having that balance between work and your personal life is certainly an important area to focus on. And I mentioned the gratitude journal, which is just what it says. It's a 365-day gratitude journal app where I actually downloaded it myself a while back and sort of has different sayings or quotes, and then you're able to write out some of your own gratitude pieces. This is just a little poster, or you can print this off just as a reminder of different ways that you can maintain that mindfulness. There are so many different types of tools, and mindfulness is really a type of medication that helps you be aware of what you're sensing and what you're feeling, kind of be in that moment. You're not judging, you're not interpreting. Particularly helpful if you tend to have racing thoughts or negative thoughts that pop into your mind. I can't imagine anyone during this crisis not having some of those negative thoughts or racing thoughts coming through their mind. So using different mindfulness techniques helps you sort of remove that, but it does take practice. And some of the tools that you can use are those apps I just mentioned, but also there are some different mindfulness exercises that you can use. There's one called the body scan meditation, where you kind of lay on your back, kind of in a prone position, where your arms are at your side, palms are up. If you can kind of think of that very typical meditative stance, or if you're into yoga, and you're focusing your attention really deliberately on each part of your body in order from your head all the way down to your toes, and you're kind of doing this mental scan, this body scan of the sensations and emotions or even thoughts associated with each part of your body. So that's something that you can take a few minutes in the morning or the evening or whatever time during the day you might need it to just do this body scan meditation. When we think about balance, we're really looking at that work-life balance. Helping to separate work and home right now is very difficult. I don't know about you, but I need to do something concrete to separate when work is over versus when it's time to move on into my family and personal life. I have to physically shut the door of my makeshift, spare bedroom home office to make sure that I'm making this split a little bit easier for me to see. Your work could really spill into many, many hours. And I think it's important, I think many people recognize the importance of having this work-life balance, but particularly now that we're home, it's very easy to just spend as much time as you want or stretch your day out so much that it feels like you're only working. You may want to consider some of the following, like keeping a schedule that includes some time for work, maybe play and rest. I know for me, I don't really do well with schedules and keeping lists, but some people actually schedule out. My daughter is very much a scheduler. She's 16, and even on her agenda, it'll say yoga. It'll have blocks of time carved out for her to really work on some of the things that she knows is important for her to maintain this balance. Avoiding information overload is so important right now. I had to actually limit the amount of time that I sat in front of the news or looked at my phone at the news related to COVID. It was becoming so overwhelming that I was almost stuck at certain points. So I had to limit my information to really reputable sources like the CDC or WHO, looking at the news or hearing information about COVID-19 in very brief increments. So for me, it was just a few minutes in the morning. I'd allow myself to look at the news, and a few minutes at night. I've actually even canceled out the evening one now and just kind of check in with my husband and kind of get the update from him. But for me, that overload was just becoming so difficult to get unstuck. Getting outside is another way, taking that walk or stretching. If you are walking outside, certainly do it, protect yourself or wherever you're walking. If the guidelines are to wear the mask, certainly you would need to do that, but just getting out and practicing that social distancing while you're out walking or riding a bike. People say walking on grass and bare feet is also a nice way to feel grounded and to feel centered. And I agree, that's kind of a nice feeling as well. And then it's not up here, but of adjusting your expectations during this time. I don't know if you've been seeing these different memes that are, if you're not learning a new skill, then you are wasting this time, or if you're not learning a new language, you're wasting this time. To me, that creates so much more anxiety and so much more stress, because I feel like I'm just trying to survive this. I'm trying to just get through the day, get through my grocery shopping, help my kids with their schoolwork. And that expectation that you've been seeing has been really overwhelming to me in particular. So shifting those expectations and realizing it's okay if you wanted to open up a can of pasta or, you know, a jar of soup or whatever. Maybe I got that mixed up, but yes, having those expectations. You don't have to bake the sourdough bread that you're hearing everyone talk about, or, you know, make homemade tomato sauce. It's okay to just do what you need to do to get through this and take care of yourself and recognize that this is difficult. This is difficult for everyone, and helping us to adjust those expectations that we might have had for ourselves. You know, at the outset of this, I was thinking, oh, I'll do yoga so much. I'll come back to work and I'll be fit and I'll be so healthy. And I think I've done yoga once or twice. You know, I've done other types of exercise and stretching, but it's adjusting those expectations to really allow us the opportunity to just feel taken care of right now. And maybe that's what some of us need, is just to sleep in a little bit, spend more time sleeping and relaxing, and not feel like you need to get out of your PJs every day. You know, as long as you're taking care of yourself and doing some of the other wellness strategies, adjusting those expectations may also combat this overwhelming feelings that you might have. Some apps that are potentially useful: a water app, kind of making sure you're drinking your daily water. I know for me, we had a water cooler in our office, so it was very easy at work to drink water. At home, for some reason, it's not as easy. So the daily water app helps you kind of identify when it's time to drink water, or how much you've had for the day. A yoga app, and Calm is also another app that will help with this balance. I use an app called Provider Resilience, which is, you could download that, but that was designed for people working in the military, working with people with veterans, but very applicable to providers of all mental health services. And it tracks your burnout, and it tracks vacation time. It tracks all those types of indicators that we might miss out when we're in the thick of our work and in the thick of some of these really traumatic events. So it helps us sort of track when it's time to adjust our self-care accordingly. So we're into the C of the ABC. So we want to talk about connection. And that's very difficult now. Physically staying connected with people is not happening. So the alternatives, I'm sure you're all at this point, a month and a half into this, have all figured out some ways to stay in touch with your family and friends. And some of these apps might be useful: GroupMe, House Party, and Netflix. But Zoom, we in our department have been having weekly Zoom get-togethers at the end of the week, just to talk about usually non-work stuff and just see each other's faces, chat a little bit. And it's been really nice to have those experiences to stay connected. Scheduling time to vent. I have a couple of friends who, at the very beginning of this, that's all we talked about. We were just venting about our frustrations, or venting about how sad it was for our kids who aren't going through the normal high school events right now, or just how difficult it is to work from home, and just venting all the time. And it seemed like that sucked a lot of energy from all of us. So now we schedule a few minutes. Okay, let's just talk about what's going on, a couple of minutes. I mean, we don't officially say that, but we've kind of taken the lead of one another that it's just not helpful for any of us to just vent the whole time. So we might spend a few minutes just sort of talking about our frustrations and then move on to more positive things or things outside of this or not relevant to the COVID-19. Even sharing text with your colleagues. I have a colleague that I work with, and she and I have been texting quite a bit just to stay in touch, and many of it's not work related. It started out being kind of work stuff, but then kind of turns into just like, hey, what's happening? How are you doing? And we kind of rely on those texts. And she's someone that I typically wouldn't have texted with that frequently in the past, and it's just something that we found has been really helpful. So these resources and apps that we're talking about really are just tools that we have found particularly useful, whether personally or have read up on them a little bit, but we don't endorse any of these tools, just to make it clear. But again, check them out. Most are free. Maybe some are very minimally low cost. So we talked about the ABCs of our own wellness and helping to maintain our own self-care, kind of looking at the awareness, balance, and connections. Another stressful area that we touched on briefly in the beginning was continuing to engage individuals receiving services. So most of our work, as we talked about, really does focus on face-to-face, seeing people's expressions, looking to see if there's incongruence between how the person is physically, how the person physically looks, or their eyes, or their lack of eye contact versus what they're saying. And it's very hard to do that remotely if you're not using a video type of resource. So continuing to engage with clients can also be a challenge, and again, brings up a lot of those feelings potentially of guilt and not doing enough. So some tools that you might use could be the good old snail mail. I've heard a lot of people talk about using mail or even dropping items off in people's homes, like, you know, within the 6-foot distance, of course, and very safely. But some individuals you're working with may not have minutes for their phones. They may not have remote technology access. They may not have the resources to communicate with Zoom or other of these remote telehealth methods. So sometimes just mailing something putting something in the mail that you and the person could maybe touch base briefly on over the phone could be very useful. Or this might be a time to explore with the individual receiving services other resources that might be out there to help the person maybe upgrade to a smartphone. Maybe there are loan programs. I know in Washington State, they have a laptop loan program, which may be something in your areas to explore with your mental health the overseer of your mental health services. Maybe they have certain laptop loan programs or smartphone loan programs. Maybe local libraries have these loan programs as well, but those are types of resources that might be useful during this time. And even when we're not in this crisis and working remotely, it could also be a good opportunity for individuals you're working with to learn some of the new remote methods of communication if they're not familiar or interested in that now. I mean, this could really help develop an interest and a comfort with using some of that technology. These are just some telehealth and texting tools. At this point in the pandemic, you may have already accessed some of these. Working in your behavioral health care organizations, you may have ones that you are currently using or encouraged to use from your administration. By all means, please use those. These are just a list of some of the ones that are available: Zoom, Mega Meeting, Telemedicine, VC, DoxyMe, some texting tools. that are HIPAA compliant are the 3 that are listed. There have been some HIPAA regulations that have been lessened during this time, so you may want to check into those. Some of the Zoom apps that you may have may not be HIPAA compliant, but there are ones that are. You could look into those. But the ones that are not HIPAA compliant, there may be some loosening of regulations now during this pandemic that allow you to use some of these tools that your agency may not have allowed in the past. So check it out, check with your administrators. Texting is something that I know, just working with different teams and different organizations, has always, for the organizations that I've worked with or have worked closely with other staff, wasn't really something that was done very often. Now might be the time to shift policies or practices to maybe allow more of that. If you're in an administrative role, you might want to really look at loosening some of those regulations as well, particularly people who are younger. Texting is a very comfortable and easy way to talk with people. So we are nearing the end, and this quote was just, I thought, kind of really, to me, suggests that when you're beginning to feel like you have no time to relax, when things are so hectic and spiraling, and work has been either more relaxing for you, or it could be at this point even more challenging because you're doing a lot of different tasks on top of maybe your everyday work activities. So it could be a time where you're not relaxing at all or taking care of yourself. But know that when you begin to feel that there's no time to relax and I gotta keep moving, that might be that exact time when you do need to make the time to relax. So it might be now saying, I need to carve out time for my own self-care. I need to really try to make this work-life balance work for me, working remotely with these new challenges, which are trying to remain productive at work, homeschooling possibly children or others, feeling physically well, or continuing to stay healthy and strong. This might be the opportunity for you to really give yourself permission to slow down. You're not rushing to get home from work at 5 o'clock to cook dinner and help with homework or whatever your evening tasks or chores might be. Now might be the time when you can relax and really adjust to this new schedule in a way that might even create some opportunities to continue to maintain this work-life balance moving forward. So think about one thing that you can do this week or in the next 2 weeks to sort of adjust those expectations like we talked about, or whatever time period works for you, that you can do to improve your wellness in one of the areas of either awareness, balance, or connection. And you'll have this presentation when you are home, so you can also continue to think about different ideas and different strategies. But we have a few minutes if you wanted to jot down in the chat box. I'll remind you of some of what was in each of those overarching categories. So remember the awareness, talked a lot about mindfulness, journaling, meditating, practicing gratitude, breathing. In the balance, we really highlighted maintaining that work-life balance in addition to maybe identifying something playful or something joyful that you want to do. taking a walk, getting out in nature, avoiding looking at the news so often that you're experiencing this information overload. And then for connection, we talked about sharing experiences with colleagues, friends, family, scheduling that time to vent, staying connected somehow, whether that's through weekly Zoom game nights that you might have with your friends or whatever it might be, but maintaining that connection with people in spite of the stay-at-home orders. So are there any in the box that we want to chat about before we end this session?
There's lots of things here, Joni. So lots of really great things. So, you know, trying to take some more time to exercise, yoga, meditation, taking breaks, keeping your water bottle near throughout the day. I know I had that problem when I'm at the office. I drink water all the time. And since I've been home, I haven't been. Remembering not to overwhelm ourselves with to-dos. Doing more breathing exercises, journaling, meditating, centering oneself, going for a short walk, just moving your body, connecting with family and children. Lots of really great things, practicing gratitude. So I think we did have we had at least one question also.
Okay.
And that was, could you say the name of the app you were referring to earlier? I think it was the one when you were saying something about the VA uses it?
Yes, it was the Provider Wellness.
Okay.
So if you just Google in your app store or look in your app store, Provider Wellness, Provider Wellness. Oh no, I'm sorry, Provider Resilience. No wonder why I probably couldn't find it. Provider Resilience.
Provider Resilience, excellent. We did also just have a comment that came into us around the phones saying that the Virginia Medicaid has free smartphones, one per family, that have lots of data and minutes. So I don't know, I'm sure that's a state-by-state thing, but that may be something to look into if you're working with folks who either have limited minutes or data or who don't have access to a smartphone, to see if your state Medicaid is providing some additional assistance around that. So I think those things would be helpful. I was also hoping, Joni, that we could ask our participants what else they feel like they need right now. Oh, you were getting there. Go ahead.
Yes, if we don't have any more questions, we did want to ask, what specific resources or supports would you find useful during this time? So we want to respond to your request as best as we can. Are there resources, supports, even different skills that you might want to improve during this time that we could potentially develop products or webinars around? So please write those in the chat as well.
Everybody else is thinking so well about what they're going to do to improve their wellness. So somebody has added, so we had some mutual support meetings that we had been doing. And one of the participants is saying they were able to make it to the one last week, and it was really helpful. So that's wonderful. I'm so happy to hear that, Katie. We are looking to add additional mutual support meetings. So if anybody is interested, we will be sending out notices about that, and they'll be on our website as well. We had scheduled meetings for direct care providers. We had one mutual support meeting for that group. We also had a group of clinical supervisors and a separate group for administrators. And the idea there was, just like it sounds, to offer support to each other. They're facilitated by wonderful facilitators, but it's also just an opportunity to talk about what's working, talk about what people are struggling with, and to try and get some support and input on those things. We also have some comments about guided breathing exercises might be helpful.
Mm-hmm.
And we'll take down these other comments: telehealth, teletherapy,
Mm-hmm.
documentation for those telehealth services. That is challenging as well. So we'll write down all of these comments. We really appreciate them. There's more than I can get through here. Let's see, and let me just see if there's another. Okay. More information. Many great ideas here. And lots of comments that I wanted to highlight of people sharing that they really needed to hear the message that that they don't have to do everything and be everything to everybody. So just modifying some of those expectations. It looks like a lot of people really needed to hear that message. So I'm glad that was conveyed. Anything else, Joni?
No, just on the screen. And again, you'll have these when they're emailed to you, but if you need help due to some really overwhelming feelings of sadness, depression, or anxiety, please get in touch with these resources. And these are some additional resources, mostly related to the current crisis. Some are more general, you know, again, the telehealth resource centers, the recovery resources we didn't really talk about, but these are a list of virtual recovery. So when you think about AA, NA, other recovery groups, you can log into this PDF file and it'll give you a list of different virtual groups that are being held. And then the
Great.
CDC, of course.
Thank you. And if you go to our website listed here, you will also see, we also have a COVID-19 page that has resources we've developed on self-care for yourself, for providers. We also have one that's really on self-care more for the general population or for participants who might be in your programs. We also have one focused on educators. And there's also a link to the national MHTTC, which pulls together resources from across the country. So you can go there as well. There's many recorded webinars that are available, you know, whenever you want, and also notices of upcoming webinars and other trainings. So I do see in the chat, so we do have a brief survey with a link. Some of the modifications around Zoom are that they don't allow for posting of live links in the chat box. So we apologize for that. We will email you that link soon after this webinar so that you can go to the live link there. And that will be wonderful.
Great.
Thank you.
And anything else?
I think that's it. There's so many great ideas and questions in the comments box. So we will review all of those after the webinar, and we'll take all of that input and use it to inform our upcoming activities. So thank you very, very much.
Yes, thank you. Please follow us on social media. We have a Facebook and Twitter account.
Great. Thank you for your participation. We appreciate it. Be well, take good care of yourselves, and thank you so much, Joni, for your facilitation of this webinar.
Great. Thank you. Take care, everyone.